Looking back over the past century, there have been three flu pandemics which we can cross-reference. In 1918, the Spanish flu killed more than 40 million people, 675,000 of which were U.S. deaths. In 1957, the Asian flu killed nearly 4 million people, 70,000 of which were U.S. deaths. And in 1968, the Hong Kong flu killed nearly 4 million people, 34,000 of which were American deaths.
To put that into perspective for you, the Spanish flu alone took the lives of more Americans than both the world wars combined. With the world population today more than tripled since 1918, what is to stop a modern pandemic from claiming upwards of 100 million lives? Human cases of avian flu change weekly, but as of June 2007, there have been 310 human cases with 189 deaths. The mortality rate has been consistently around 60%. Many people in these regions have contracted the virus due to their living in close proximity to infected birds. There have been 10 cases in Vietnam in which patients showed unusual symptoms. They lacked a sore throat and runny nose. 3 patients reported coughing up blood phlegm, while 7 experienced diarrhea. Of the 10 patients, only 2 survived. The avian flu may seem worlds away, but the reality is that it's right next door. We could almost predict the spread of human cases just by looking at the migratory pathways of birds. Wild birds carry the virus, but are usually asymptomatic. Migratory birds that fly through Nebraska mix with birds across the Bering Sea into Siberia during their summer nesting season. The migratory routes of Nebraska birds overlap with the routes of infected birds. We suspect that the avian flu will soon be seen in the migratory birds that fly through our country. Recently, the USDA has increased random sampling of birds to identify when the threat emerges. There may also be new recommendations for hunters regarding the use of gloves when handling wild migratory birds. Exposure to the bird flu is also likely as our society is extremely mobile. Once sustained transmission of the virus is achieved, it will spread quickly. For example, if an individual with the newly mutated bird flu virus traveled from Asia to the Denver International Airport, according to some predictions, it could take only 48 hours to spread all across the United States. Using data that was gathered from the pandemic flu of 1918, experts predict that an avian flu pandemic could cause serious social and economic disruption, with nearly 100 million Americans becoming ill, 1.5 million of them dying, and an economic loss of $71 to $160 billion. Such a pandemic would translate to 500,000 infected Nebraskans and 10,000 deaths.
Experts at the World Health Organization and elsewhere believe the world is now ripe for yet another influenza pandemic, the first of its kind since 1968. That's when the last of the previous century's 3 pandemics occurred. This is why there's been so much preparation, so much funding for a pandemic in the United States of America. 2 of the 3 requirements for a global pandemic to occur have already happened.
The World Health Organization uses a series of 6 phases of pandemic alert as a system for informing the world of the seriousness of the threat and of the need to launch progressively more intense preparedness activities. The world is presently in Phase 3. A new influenza virus subtype is causing serious illness and death in humans, but is not yet spreading efficiently and sustainably among humans. Much of the public health planning is coming from the lessons we learned from the previous pandemics, developing priority guidelines for vaccine and antiviral medication, when to encourage citizens to limit travel to and from regions that are infected by the pandemic, looking at alternate facilities to care for ill people, and when to close schools, cancel parades, and postpone sporting events.
Currently, the World Health Organization is monitoring avian flu and making recommendations on vaccine composition based on surveillance data. There are globally 89 countries with influenza centers monitoring data. But what are Nebraska officials doing to prepare right here at home?
The Two Rivers Public Health Department, whose mission is to assess and monitor the health status of their 7 county districts and helps ensure that local agencies and the public are prepared. A local pandemic influenza planning committee was developed in each of their 7 counties and comprised of stakeholders in the medical community, schools, government, emergency management, and many others. These planning committees have been working together to help create our district's pandemic influenza response plan.
At the University of Nebraska-Kearney, the emergency operations team has formed the Pandemic Flu Committee. They're continuing to develop a plan to provide widespread education to administrators, faculty, students, and parents as well. The Pandemic Flu Committee meets on a bi-monthly basis to discuss
the gathering of supplies, how to implement social distancing, what measure to take to prevent the spread of the illness like cough etiquette and hand hygiene, and how will it affect residential life on campus? As health officials around the world are preparing for the possibility of the flu pandemic, it's time for you to take action as well. Individuals should monitor reports and the status of the avian flu. They should gather needed supplies. The Two Rivers Public Health Department provides a brochure with a 16-week plan to gather the supplies you will need. This is something that should start today, as there may not be time once a pandemic emerges. Most importantly, individuals can prepare by developing good health. This includes practicing good cough and sneeze etiquette. When respiratory infections circulate in the community, one should frequently practice good hand hygiene by washing hands or using alcohol-based hand gels. An annual influenza vaccine can protect against seasonal, non-pandemic strains of influenza. Besides saving lives, this will also reduce the chance that a bird flu strain and a human flu strain might mix and form a new novel hybrid virus that goes on to start a pandemic.
The possibility of a pandemic is real. We hope that you take action. Contact your local health officials. Go online. Get prepared to find out what you can do to be ready for the pandemic influenza.